The surge of cluster cases in the state of Victoria instigated the extension of a lockdown. However, the restrictions implemented are now at ease as cluster cases are under control. Eagle News correspondent Patricia Madronio has more details. Patricia?
Last week's incident of a nurse becoming infected with the COVID-19 virus and working in both the Epping Private and Northern Hospital was possibly infectious caused Melbourne to undergo its fourth snap lockdown since the pandemic began last year. On the 17th of June at 11:59 p.m., with the number of new cases decreasing to just one, of whom was a close contact of the infected in quarantine, the lockdown restrictions were able to be eased and Melburnians were able to breathe a sigh of relief. While the conditions have not yet returned to the relaxed coronavirus procedures previously implemented, Melburnians are now able to travel throughout the state from within the CBD to regional areas outside of the previous 25-kilometer limit. This is just in time for the many residents who were planning on visiting the snowfields and partaking in some skiing during the winter's snow season. Visitors, however, must have a negative COVID-19 test result within 72 hours of traveling. Other ease conditions in Melbourne include the reopening of gyms and indoor entertainment venues, increased density limits of dining establishments, and removing the mask requirement for outdoor activities where social distancing can be maintained. Additionally, the Victorian government is ensuring that vaccination efforts are maintained, with over 80,000 vaccines being provided to Victorian residents per week. Although some restrictions are still in place, the efficient response of Victorian health officials and the Melburnian public allowed for rapid control over the rise in cases in the last week, and Victorians are hopeful that they are well on their way to no locally acquired cases and relaxed restrictions once again. Reporting from Gold Coast, Australia, I am Patricia Madronio, Eagle News. We live in interesting times.
Thank you, Patricia. We are relieved to see the control of the virus.